From VOA Learning English, this is the Health Report. Americans can eat an egg a day without feeling guilty. The U.S. Department of Agriculture and the Department of Health and Human Services recently released new dietary guidelines. They are updated every 5 years. The guidelines are designed to help set nutritional standards for school lunch programs and federal food aid. The new guidelines say a healthy person can eat up to 7 eggs a week. The U.S. Department of Agriculture says 1 large chicken egg has about 186 milligrams of cholesterol. Most of that is in the yolk, the yellow center of the egg. The report says the human body makes cholesterol on its own, so people do not need to eat eggs or other food to get cholesterol. The report provides other advice about staying healthy through diet. It calls for limiting added sugars to just 10% of calories per day. Natural sugars, such as those in fruit or milk, are not considered added sugars. The report also talks about saturated fat calories. These can be found in red meat, butter, cheese, whole milk, and ice cream. Calories from saturated fats should also be limited to less than 10% of total calories each day. The guidelines also suggest Americans move away from a diet full of animal protein and sodium or salt. The guidelines suggest a diet containing more fruits, vegetables, and nuts. The report also mentions the importance of physical activity in improving health. It says that physical activity can reduce your risk of disease. For VOA Learning English, I'm Ann Ball.
From VOA Learning English, this is the Health Report. The World Health Organization is expressing increasing concern about a virus that is similar to the respiratory disease known as SARS. The WHO calls the newly named disease Middle East Respiratory Syndrome Coronavirus, or MERS-CoV. Most cases of MERS have been reported in the Middle East, mainly in Saudi Arabia. But cases have also been found in other countries, including Italy, Tunisia, Jordan, Britain, and France. Since September, the WHO has been informed of more than 50 laboratory-confirmed cases of MERS. At least 30 people with the infection have died. WHO spokesman Gregory Hartle says public health experts need to learn how humans get infected in order to be able to control it. And he says experts need to develop ways to treat the disease. Mr. Hartle says so far, all of the confirmed cases of the disease have had something in common. All the cases have had a travel connection to the Arabian Peninsula. Mr. Hartle says there have been very few cases where infected people returned home and transmitted the virus to other people. But 2 cases in France suggest that close contact can cause the virus to spread from person to person. A man sharing a hospital room with a patient with MERS later developed the infection himself. A new study published online by the Lancet Medical Journal suggests that people with MERS should be kept away from other people for 12 days. The Director General of the WHO, Dr. Margaret Chan, has described the MERS virus as a threat to the entire world. Symptoms of the disease include cough, fever, and difficulty breathing. For VOA Learning English, I'm Carolyn Presutti.
From VOA Learning English, this is the Health Report. Sweden's Nobel Prize Committee says the 2015 Nobel Prize for Medicine will go to scientists from Ireland, Japan, and China. William Campbell from Ireland and Satoshi Omura from Japan share the prize for their discovery of the drug ivermectin. The Nobel Committee praised their work on what it called a novel therapy. The treatment fights infections caused by roundworm parasites. Doctors are now using ivermectin to treat river blindness. Mr. Omura said the drug came from a substance taken from a microbe found on a golf course near Tokyo. The prize for medicine is also going to Chinese researcher Tu Youyou. She discovered artemisinin. Artemisinin is a drug that has sharply lowered the number of people who die from malaria. The committee said the discoveries have given the world powerful new ways to fight 2 dangerous diseases. It said those diseases affect hundreds of millions of people every year. The committee added that the consequences in terms of improved human health and reduced suffering are immeasurable. Ms. Tu is the chief professor at the China Academy of Traditional Medicine. Mr. Campbell currently works as Research Fellow Emeritus at Drew University in New Jersey. Mr. Omura has 2 doctorate degrees, one in pharmacological sciences, the other in chemistry. He is a professor emeritus at Kitasaku University in Japan. For VOA Learning English, I'm Ann Ball.
From VOA Learning English, this is the Health Report. A top health expert warns that the world needs to deal with what he calls the first Ebola epidemic the world has known. Tom Frieden, director of the U.S. Centers for Disease Control, spoke to reporters at the CDC headquarters in Atlanta, Georgia. He warned that the Ebola outbreak in West Africa could spread widely. He said a huge global effort is needed to contain the disease. Dr. Frieden just returned from a visit to the most affected countries, Sierra Leone, Guinea, and Liberia. He said Ebola cases continue to increase quickly, even though healthcare workers are working extremely hard against the spread. News reports say the number of cases is more than 5,000. Dr. Frieden warned that there is a window of opportunity to stop Ebola, but he added that window is closing. The CDC chief said the Ebola virus is spreading in two ways, from patients to caregivers and through unsafe treatment of the dead. Dr. Frieden warned that each day's delay in dealing with the Ebola spread makes it more difficult to stop. The CDC director said resources, technical experts, and a worldwide organized and unified plan are needed. He said Ebola is not only an African problem, but a world problem. U.S. health officials have announced an agreement with a California-based drug maker, MAP Biopharmaceuticals. The deal calls for the company to speed development of the experimental Ebola medicine ZMapp. ZMapp has not been tested on humans, but 2 American medical missionaries who had Ebola were treated with the drug and recovered. For VOA Learning English, I'm Laurel Bowman.
From VOA Learning English, this is the Health Report. 1 billion teenagers and young adults around the world risk losing their hearing by listening to loud music. This is according to the WHO, the World Health Organization. The damage people are doing cannot be reversed or fixed. Many people like to listen to loud music, especially rock and roll. But really loud music can have a serious effect on your hearing. Dr. Shelley Chadha is a specialist on hearing damage for the WHO. Dr. Chadha says that the cells we use to hear, called sensory cells, can be permanently damaged by loud sounds. Studies in middle and high-income countries show nearly 50% of teenagers and young adults aged 12 to 35 years listen to unsafe levels of sound. They are listening on their personal audio devices as well as at concerts, nightclubs, and other entertainment places. The WHO says there are many kinds of unsafe levels of sound, depending on how loud the sound is and how long you listen to it. Unsafe can mean noise levels of 85 decibels for 8 hours a day or 100 decibels for just 15 minutes. Dr. Chadha says when the intensity of sound increases by 3 decibels, safe listening time goes down by half. She adds that people can protect themselves from unsafe sound levels by wearing earplugs during concerts. Another common sense suggestion is to turn down the volume on your personal audio devices. The WHO also advises young people to limit use of such devices to less than 1 hour a day. The UN agency estimates 360 million people suffer from hearing loss linked to many causes. It notes half of all cases of hearing loss can be avoided. For VOA Learning English, I'm Jonathan Evans.
From VOA Learning English, this is the Health Report. Many people fear a visit to the dentist. They are afraid of the dental equipment and treatments. Now, a British company says it has developed technology that will end the need for mechanical cleaning of dental cavities. Dentists have been repairing cavities the same way for a long time. They first remove the bad tooth tissue with an electric drill. Then they fill the hole in the bone with a metallic or plastic substance. The process can be unpleasant and sometimes very painful. Tooth enamel covers the outside of the tooth. The enamel of a damaged tooth can be replaced naturally. This process is called remineralization, but it is too slow to stop bacteria from building up in small, narrow areas of the enamel. A British business called Reminova has developed a method for speeding up this natural remineralization of early stage cavities. Jeff Wright heads the company. He says his company found a way to make remineralization a much faster process. They add calcium and phosphate minerals to the enamel that is there. First, they clean the cavity. No power tools are needed. Then the dentist covers the area with a mineral solution and uses an electrical current to harden this material. The patient does not feel the electricity. The hardened mineral completely fills the cavity. Dentists say the new method works best on early stage cavities. Researchers say they believe the new method can be further developed for treating late stage cavities. For VOA Learning English, I'm Ann Ball.
From VOA Learning English, this is the Health Report. How far would you go to get a perfect body? Many people these days are traveling to South Africa to get their version of perfection. People from across Africa and around the world visit for so-called surgery safaris. They seek smaller stomachs, firmer bottoms, or maybe new eyes, noses, or chins, known as cosmetic surgery. Businesses that provide medical safaris say they have seen a large increase in African customers. And South Africa is becoming a center for these kinds of medical operations. For years, South Africa has appealed to medical tourists from Europe and the United States. But local cosmetic surgeons say now more people from Africa's growing economies are interested. Lorraine Melville is a doctor with Surgeon and Safari. She has been performing cosmetic surgeries for almost 16 years in Johannesburg. She says more than 80% of her clients now come from sub-Saharan Africa. They are treated like movie stars. Assistants take them from the airport to a beautiful guest house. Doctors operate the next day, and then patients stay a week or more as their bodies heal. They spend anywhere from $5,000 to $7,000 on each cosmetic treatment. They might spend an additional $2,000 on the cost of the hotel while they heal. Dr. Chris Snijman is the National Secretary for the Association of Plastic and Reconstructive Surgeons of South Africa. He says the country has better and safer surgical methods than many others. And he says South Africa has a favorable money exchange rate. But medical professionals also say there must be stronger laws established to govern the industry as it grows. For VOA Learning English, I'm Carolyn Persutti.